I came to know MaryAnn Black at the time that Duke Medical Center was involved in creating the Duke University Health System. It was in a very important time in healthcare where to be able to deliver the quality of care that we felt needed to be delivered in North Carolina, and also to protect the viability of Duke medicine, we needed to create a health system. In order to do that, a very important linchpin of the system was having a community hospital, and particularly a hospital in Durham. I came to know MaryAnn Black and know her very well through the period of time in which the county commissioners of Durham were trying to determine who was going to be the best partner for Durham Regional Hospital. And MaryAnn Black was the chair of the county commissioners. Well, MaryAnn Black's role cannot in any way be overstated. The county commission was going to be involved in voting as to who the partner for Durham Regional would be. This was a very important decision for Durham City and Durham County. The county commissioners were quite split. There was a lot of controversy there. There were people who were strongly opposed to having Duke be the partner for Durham Regional. MaryAnn Black, through her leadership, through her determination, ultimately, I think, brought the county commissioners to making the right choice for the people of Durham, Duke. And I think it was through her leadership that that relationship came about. Well, I think the benefits to the people of Durham were tremendous, and the necessity of having an anchor community hospital in Durham was tremendously beneficial to the Duke University Health System. In the people in Durham, they have a totally synergistic relationship between Durham Regional Hospital, Lincoln Community Health Center, and the Duke University Hospital and clinics and physicians throughout the entire county. I think the people of Durham are blessed, in my view, by having providers who are deeply concerned about the people in the community. So one of the ways that the people in Durham benefited, not only having a not-for-profit, your own neighbors, people who live here, caring for the people of Durham, they've had a tremendous investment in community services by the Duke University Health System. Her role was tremendous. The Health Summit was really led in many ways by MaryAnn Black. Once we brought her into the Duke University Health System, I believe it was 2002, the role was to maximize the benefit to the people of Durham of the relationship between Duke University Health System, Lincoln, Durham Regional Hospital, but more importantly, involve the people of Durham in their own health. A very profound idea came up at that time. In many ways, it seems obvious now, but it was very unusual, almost revolutionary then, that the role of a health system is not only to treat disease. Up until recently, people only went to their doctor, to the hospital when they were sick. That was the role of the health system, which was really a sick care system. The concept that came about once we created the health system is that we ought to be dealing with health in addition to disease. Let's improve the health of the community of Durham. So the idea that we had, and this was very collaborative, is to move from Durham, the city of medicine, to Durham, the community of health. And we decided to do this, we needed to bring in all the constituencies that were involved. And that's where the idea of the summit came up, and MaryAnn Black, from my perspective, was the one who was the point person for that. I recruited her and brought her in, I think in 2002, as Director of Community Affairs. I brought her in for a number of reasons. Number one, I knew her. I knew her because I negotiated against her. She was a tough person to negotiate against. And one of the reasons she was so tough is she was so nice. She was so sincere. She deeply believed in what she was doing. She was representing the people of Durham. She was unswerving, which is all good, all good. But she was unswerving. So I was very impressed. I figure anybody who was so tough to negotiate with, I would much rather have them on my side. I admired her. She was a good person in her own quiet way. You couldn't help but feel her strength. We were aggressively wanting to engage more in Durham and try to truly improve the health of the citizens of Durham. I could think of nobody better than her. We already had Gene Spalding in a position of leadership to help us oversee community programs. I knew that MaryAnn Black would be a doer. She would get in there and do it. And that's the reason I recruited her. We wanted to fulfill our promises that we made when we leased Durham Regional Hospital. I think she had a tremendous impact. She she had an impact because she was taken very seriously. I mean, she was very good. She had a quiet gravitas. You know, when MaryAnn Black said something, you listened, you took it seriously, and she went into it. You know, MaryAnn Black was a social worker at heart. She was committed to others, generally one at a time. But through this position in the health system, she could do it throughout the county. So her commitment, her understanding of the community and their needs, the respect that she had from all other entities. She was considered to be a true honest broker. And the fact that she devoted her full energy to this. So she was very effective during the time that I was chancellor. Oh, I think the impact on the community is tremendous. You know, now that I'm no longer chancellor, I still get involved in issues that relate to the community. So I've been in a number of meetings where I see in our boardroom where I see every aspect of the community talking about enhancing health of the citizens of Durham. In many ways, this is a legacy of MaryAnn Black, bringing all the constituencies together to work to improve health as well as to care for people with disease. And to understand that health relates to all types of factors that impact on people's health. You know, what we're understanding now, and our Chancellor, Gene Washington, is a leader in this area, understanding the social determinants of health. Moving, if you think about where healthcare has moved, it's really interesting. Moving from the focus of treating a disease of an individual to moving to understanding individuals' needs and improving their health and preventing disease, to understand the needs of not only individuals, but the needs of a community. And the needs of a community are very different because some people are doing quite well or affluent and could go to workout facilities and eat really good healthy foods and go to Whole Foods and get everything organic. And other people either can't afford food or don't have a source of healthy foods or can't go out and walk in a safe place. So if we are going to be responsible for the health care of a community, we need to understand those social determinants and factor those all in. This is a legacy to MaryAnn Black's work. The fact that we have expanded so broadly to encompassing the needs of a community in relationship to their health. Her legacy to the people of Durham is being one of the founding creators of the concept of Durham, a community of health. Having the will, the capability, the resources, and the focus to do everything that we can to improve the health of the citizens of Durham with total equality and understanding of individuals' needs. MaryAnn Black was a tireless servant in many ways of the people of Durham. She was at heart a social worker. She was compassionate. She cared for other people deeply, meaningfully. In an unassuming way, she was a powerful leader of modern Durham. And under her leadership, amongst many other things, she has developed a coherent, strong focus to improve the health and lives of the people of Durham. MaryAnn Black, I think, at her very heart was compassionate. She was determined. She was not ego-driven. She had grace. She was selfless. And she was a good person, and that goodness shone through her.